Hello, my name is Jenny Rhodes, and today I would like to talk about pancreatic cancer in the United States. The pancreas is an organ located in the abdomen, behind the stomach, and in front of the spine. It is surrounded by many other organs, including the liver, small intestine, and spleen. The pancreas is divided into three sections: the head, the body, and the tail. The pancreas is an integral part of the digestive system and has two vital functions, an exocrine function and an endocrine function. The exocrine function aids in digestion through exocrine glands, which produce enzymes that break down fats, carbohydrates, and proteins. About 95% of pancreatic cancer begins in the exocrine cells. In the endocrine function, islets of Langerhans release insulin and glycogen directly into the bloodstream. These hormones are crucial in maintaining proper blood sugar levels for the functioning of other key organs, including the kidneys, liver, and the brain. Pancreatic cancer is the fourth leading cause in cancer deaths and is predicted to be the second highest by 2020, falling short only to lung cancer. Once diagnosed, the median survival rate is 5 years. Despite the severity of the disease, only 2% of the National Cancer Institute research funds go towards pancreatic cancer. By the time symptoms start occurring, the cancer has typically grown outside of the pancreas. Symptoms that arise due to the growing tumor include weight loss, jaundice, itching, nausea, vomiting, abdominal pain, back pain, enlarged lymph nodes in the neck, bloating, loss of appetite, and elevated blood sugars. The United States is located in North America and has a variety of climates, including vast central plains, mountains in the west, hills and low mountains in the east, rugged mountains and broad river valleys in Alaska, and rugged volcanic topography in Hawaii. The life expectancy of Americans today is 78.49 years. Out of 221 countries, the United States ranks 50th for life expectancy. Healthcare per capita stands at $8,233, and the healthcare spending tops out in the United States at 17.9% GDP in 2011, with an expected rise to almost 20% by 2017. Although the United States healthcare is ranked most costly per person, quality of healthcare is considerably lower than that of other countries. In 2012, the average household income in the United States was $69,821. Because of the salaries that most Americans receive, lifestyles leading to cancer can arise very quickly. These lifestyles include obesity, poor dieting, tobacco use, alcohol use, and physical inactivity. Obesity is the result of poor dieting and physical inactivity. Because most Americans live an extremely fast-paced life, they feel as though they do not have time to work out. Unhealthy foods, including convenient fast food and junk foods, are also consumed due to the fast-paced lifestyle of the average American. Risks of pancreatic cancer increase by 36% for those who drink 3 or more alcoholic beverages per day. The main attributing factor is tobacco use. Smoking alone doubles your risk of pancreatic cancer and is the leading preventable cause, with 1 in 4 cases due to smoking. Fluorouracil is an antimetabolite. The drug functions as a treatment for cancer by interfering with the enzyme needed to replicate and create DNA and RNA. This halts the growth of cancer cells. The drug is injected into the veins and treatments vary patient to patient. Common side effects of fluorouracil include low white blood cell count with increased risk of infection, low platelet count with increased risk of bleeding, darkening of skin and nail beds, nausea, vomiting, poor appetite, sores in mouth, lips, and throat, hair loss or thinning, including facial and body hair, brittle nails, increased sensitivity to the sun with risk of severe sunburn, and dry, flaky, cracking skin. Mitomycin is a chemotherapy drug that works by adhering the DNA of cancer cells together, which inhibits the DNA from coming apart. Because the cell cannot divide when the DNA is permanently attached, the cancer is unable to grow. It is a purple liquid that is injected by tubes intravenously into the bloodstream. Common side effects of mitomycin include decreased white blood cell count with increased risk of infection, decreased platelet count with increased risk of bleeding, fatigue, and hair loss, including facial and body hair. Gemcitabine also belongs to the class of chemotherapy drugs known as antimetabolites and functions by slowing or stopping the growth of cancer cells in the body. When treating pancreatic cancer, the drug is injected intravenously once every week. The drug is used to treat cancer of the pancreas that has spread to other parts of the body with no signs of improvement or negative results from other medications. Common side effects of gemcitabine include low white blood cell count with increased risk of infection, low platelet count with increased risk of bleeding, anemia with symptoms like tiredness, weakness, or shortness of breath, nausea, vomiting, loss of appetite, fatigue, fever, swelling of the arms and legs or other parts of the body, and abnormal blood tests, which suggest that the drug is affecting the liver or kidneys. Despite the insufficient treatments available thus far, new discoveries linked to malaria drugs are on the rise. According to Dana-Farber Cancer Institute, scientists report that they have shrunk or slowed the growth of notoriously resistant pancreatic tumors in mice, using a drug routinely prescribed for malaria and rheumatoid arthritis. The oral drug, hydroxychloroquine, has relatively mild side effects, is inexpensive, and widely available. While no information is yet available based on the human studies, this new and exciting finding will be more than welcomed in the dreaded case of pancreatic cancer. According to the National Cancer Institute, of the 44,000 people who were diagnosed with pancreatic cancer, 37,000 mortalities resulted, with many passing away within the first 6 months.